ICMR scientists have also clarified that no new strain of H1 has been identified, as well as there is no cause for panic. So, how do you see this, sir, ma'am? And is there some other dominant influenza, or is it the same as ICMR has also clarified that this is the same one?
What we're seeing is a seasonal influenza uptick. We see this every year. Uh, the doctors feel that this year it has started a little earlier, but normally in India, we do have a monsoon seasonal increase in influenza cases, and then, of course, it continues into winter. Now, thanks to better surveillance through the government ICMR viral laboratories, throughout the year, we actually now know which viruses are circulating, which are predominant, and we can also correlate with, clinical presentation, with severity, and with hospital admissions. And so this is a very good resource, the ICMR surveillance network, and they have a dashboard where they put out this data regularly. As you mentioned, the current increase in cases is because of H1N1, a Michigan strain. It's an influenza type A virus. And it's the same strain that has been circulating actually since the pandemic in 2009, very similar to what was last year. So I think we need to reassure people that this is not a new strain. It is not something which is more transmissible or more virulent. I think there's a lot better awareness, more testing, more diagnostics being performed, and therefore more cases are being reported from many hospitals in Delhi, Bangalore, and other cities. So people might tend to panic thinking that, there are suddenly thousands of cases. It's just better testing, but also an increase in the number of people who are down with H1N1 at this particular time. But really nothing to worry about, except for those who are at very high risk of complications.
Ma'am, what are the symptoms of H1N1, and what do you think? What are the warning signs and precautionary measure that one has to take?
So the symptoms of H1N1, like any other influenza or flu, as we call it, are fever, body ache, could be sore throat, headache, fatigue, and the symptoms usually last for 4-5 days, maybe up to a week at the most. Most people tend to recover with just rest and paracetamol and plenty of hot fluids. The people who are at risk of going in for more severe complications, particularly pneumonia, are those who are above the age of 65, children under the age of 5, pregnant women, and also those whose immune system is not working that well, what we call as immunocompromised. These are also people who've had cancer chemotherapy, for example, or have autoimmune disease, or have been on corticosteroids for a long time. And because immune system is a little bit weak, in these people, it could flare up and become a pneumonia. The warning symptoms would be very high fever, which persists, not going down, nausea, vomiting, and inability to eat, rapid breathing or breathlessness, lips and fingernails turning blue, looking blue, persistent irritability, vomiting in children. And of course, the main thing is, rapid breathing, which indicates that there is a lower respiratory infection in the lungs. So if any of these warning signs are there, the person must be taken to the hospital and may require a brief admission with oxygen and other symptomatic treatment to stabilize them.
Ma'am, as we have seen that, people start self-medication. They think that, if they have influenza, which is tested positive, so they feel like, they should start taking antivirals like Tamiflu and, when it is required, what is that condition?
So Tamiflu or Seltamivir is recommended only for those who have severe influenza. And therefore, it should be taken only after the prescription by a doctor. So I think every ordinary person who has mild symptoms should not start taking antivirals or antibiotics for that matter. A lot of people tend to self-medicate with antibiotics. That's not a good thing at all. It'll have no impact on the flu. And in fact, it'll make things worse because it'll it'll fuel further antibiotic resistance. So antivirals should be taken only by those whom the doctor has prescribed. And there is, of course, Tamiflu, and there are a few other antivirals also sometimes which are used, for prophylaxis.
Yeah. Ma'am, according to the WHO online, since the outbreak of swine flu in 2009, there are certain recommendations that every year we get upgraded and updated version of vaccines. So do we have vaccines for the how many vaccines do we have right now?
There are a large number of influenza vaccines on the market. And in February of 2026, this year, the WHO updated its recommendations for the Northern Hemisphere influenza vaccines. Twice a year, they hold a meeting with experts, look at all the data from around the world on influenza strains, and they have a recommendation for the Northern Hemisphere and one for the Southern Hemisphere. So currently, the vaccines which are available in the market are largely, they're either trivalent, which means they may have three different viral strains, or they may quadrivalent. And they all have H1N1 and also H3N2. And they are mostly in line with the WHO recommended composition. So these vaccines should work for the current H1N1 outbreak. And in fact, it'll be a good idea for anybody who's at high risk, those groups that I mentioned earlier, and also healthcare workers, to actually take a shot of the vaccine, because it will protect for the rest of the season.
Uh, Ma'am, next is on pollution. As there is a latest study done by the Delhi University that Delhi's air pollution may be taking a toll on the brain, not just lung or heart, as we talk about. We discuss this issue every year. And as I was just listening to your podcast also, so there are certain solution that you have described very well. So what is the needed for the scientific, what should be the exact scientific approach to tackle the air pollution?
So this is a really, really important topic, and I'm so glad that you're asking this question. Air pollution, according to the WHO, accounts for about 8 million deaths annually globally, and 2 million of those deaths are in India. So air pollution is directly contributing to 2 million lives lost, and in addition, contributing to a lot of ill health or morbidity. And this includes everything from, of course, asthma and COPD, lung diseases, but also to diabetes, to dementia and other neurodegenerative diseases, to a young child's brain development, cognitive development. So if a pregnant woman is living in a highly polluted area and gives birth, the child's brain and body are not going to develop as well as they should, and also contributing to cancer. And air pollution, of course, consists of a large number of different gases and particulate matters, which are all now being measured very well. In India, we have a good network of devices now measuring air quality. Of course, still focused on the cities, but still we have good data now. So I think what we need to do is to firstly take an airshed approach. It's not a city by city approach, but an airshed. And we have 9 or 10 major airsheds, in the country. Like the whole Indo-Gangetic Plain, for example, is an airshed covering not only Delhi NCR, but all the way from Punjab, Haryana, Rajasthan, through UP, Bihar, and into West Bengal. So the actions need to be taken over large geographic areas. So state governments need to work together. They need to be science-based. So when we do the source apportionment studies, we know what percentage comes from transport, what percentage comes from industry, what percentage is dust, what percentage is coming from waste burning, household pollution. So these are all well documented through multiple studies. They may, vary slightly from one geographic area to another, but generally we know these are the 5 or 6 top sources of pollution. So for transport, you need to tackle it by reducing the number of vehicles on the road, improving public transport, moving to e-vehicles, more of buses and metros rather than individual cars. For industry, basically, we have the norms. The Pollution Control Board really needs to implement and enforce the rules that industries have to follow, including small, medium, and large industries. Similarly, for dust, construction dust, there are norms and guidelines how to minimize construction dust. For household pollution, I think that's a really low-hanging fruit because we have LPG access throughout the country now, thanks to the PM's Ujjwala scheme. But because of the price of LPG cylinders, a lot of women are still resorting to biomass. They still go and collect firewood or dung for cooking. So I think if we can expand access to LPG, we can immediately address the 60% of households that are still using biomass for cooking. And then the solid waste management and waste disposal. Again, burning of waste contributes a lot to pollution, particularly methane and other poisonous gases. So the solutions are there. The analysis has been done. It now requires a comprehensive and coordinated, because it's multiple sectors that need to work, and somebody needs to coordinate all of that. So I'm really looking forward to the National Clean Air Program 2.0, which we are expecting will be launched soon, and hope that it will have this type of approach, because it's not just Delhi we should be worrying about. Air pollution is affecting a majority of Indians, actually, and majority of the developing world. So it's something that, the government has to take seriously and do something about, because it's a serious risk factor for health.